Hi everyone, in this video I will be discussing about dimensions of fetal skull. I'll start with anterior posterior diameters first. So in order to know the lengths or to remember all those lengths, I've written them in certain fashion. Before I start, we have to know certain points over the fetal skull. This is the submentum, next to it is the mentum, then comes the frontal bone, then bregma, next the vertex, occiput and subocciput. Now I write down each of these 7 points in a clockwise direction. So as I told you, start with submentum, go clockwise like this, mentum, then frontal, bregma, vertex, occiput, and lastly subocciput. So there are 7 points. Middle one is the bregma. So all of this length, either they touch at bregma or they cross the bregma. You can see it here. Now we'll start to trace each of these anterior posterior diameters, starting from submentum. There are 2 anterior posterior diameters from submentum. Firstly is the submentobregmatic, that is from here to here. So we written it like this, submentobregmatic. Next is it crosses to the next level, that is submentovertical. So submentovertical. So we are done with 2 diameters from taking origin from submentum. Next we will go to subocciput, that is these 2. Again there are 2 diameters taking origin from subocciput. Firstly, suboccipitofrontal, that is suboccipitofrontal, then suboccipitobregma, that is suboccipitobregma. So 2 from the submentum, 2 from the subocciput. Then there are 2 more. So after submentum comes the mentum. So mentovertical. This is mentovertical. After subocciput comes occiput. That is occipitofrontal. So that's it. So there are 6 anterior posterior diameters. Now next we'll try to remember the lengths of each of this. The one thing that we must remember is the longest AP diameter is the mentovertical, that is 14 centimeter. From there we'll go to the either sides. So 11.5, 11.5. Next to it is 9.5, 9.5. And lastly, that is suboccipitofrontal. You will see an O in frontal. So it is O, so 10 centimeters. So that's all about the lengths of each of these anterior posterior diameters. I will write it down separately like this. Just like I mentioned, we'll start with the middle one first. Mentovertical, that is the longest anterior posterior diameter, 14 centimeter. It represents bro presentation. Next to it, so mentovertical is this one, mentovertical. Next to it is occipitofrontal, that is 11.5 centimeter, vertex presentation. Submentovertical, 11.5 centimeter, face presentation. Suboccipitobregmatic, 9.5 centimeter, vertex presentation. Submentobregmatic, 9.5 centimeter, face presentation. And lastly, suboccipitofrontal, 10 centimeter, vertex presentation. I've also written the presentation here also. Those taking origin from submentum have face presentation, while those taking origin from suboccipito have vertex presentation. In addition to that, occiput also vertex presentation. And the middle one is the bro presentation, which is the longest anterior posterior diameter. It is mento vertical. So that's it about anterior posterior diameter. Next we'll go to transverse diameter, which is nothing much to learn from there. Is biparietal diameter 9.5 centimeter and bitemporal diameter 8 centimeter. So that's it about dimensions of fetal skull. Thank you.